I'm always delighted to speak about partnership with consumers. It's a major passion of mine. I've worked as a surveyor. I've actually worked on the other side in healthcare of actually organising accreditation for large tertiary hospitals. And I've actually been a health consumer many, many times myself as well. Unfortunately, too many times, I think. What I've been asked to talk about is really what surveyors, or what the standard is really asking of organisations, and you know, consequently, I suppose what it's asking of consumers as well in terms of that partnership with staff and with health organisations. So probably a good place to start, I suppose, is actually who's online. I think it's always really interesting to know if people are consumers or they're health service staff members, if they're a researcher. So if people just want to actually let us know where they're participating, sort of what perspective they have. We know that many of you have many perspectives, like me, where I could tick a few of those. But if you could just pick predominantly which of those you are, that'd be great. We'll just give you a minute. Okay, so, that's excellent. So there's some consumer advisors, there's also, I think, predominantly health service staff members, which is great. So about two-thirds health service staff members, and about one-third are consumers and others, which is fantastic. So, but I think it's really relevant no matter where you're, to be honest, because it is about partnership. And I think that that's across the board, whether you're a consumer or a health service member, you know, it doesn't really matter. Okay, so let's get into that. So the national standard, and I think most of you would be aware that the national standards are changing in the coming years, and there's actually a big review on at the moment, and Standard 2 is one of those standards that they've looked at very, very closely to see how they can improve it and how they can actually really make sure that there's a genuine and effective partnership between consumers and healthcare professionals, which is really what I'm going to be focusing on today. So Standard 2 is really, I won't read that, I think everyone's pretty familiar with it, but really the intention is really important to create a health service that's responsive to patients, carers and consumer inputs and needs. And I think that my next slide is actually, it hasn't come up very well, but it's actually, it's a beautiful montage that's actually at the Institute for Healthcare Improvement in Boston, which has actually been very strong in the partnership with consumer movement as well as the quality and safety movement. And it's made up of thousands and thousands and thousands of patients and family members and carers and consumers' photos. So those 4 photos are actually made up of thousands of photos. And at the IHI, they have a saying, nothing about me without me, which I know Betty Johnson of Health Consumers New South Wales is very, that's her mantra as well as the Institute for Healthcare Improvement. And I actually think that every patient's the only patient, and nothing about me without me actually really does sum up what Standard 2's about. So, but because we need to talk about it in a little bit more detail, we'll actually delve a little more. So, really what surveyors are looking for and what the standard's really looking for, and I think this is actually probably one of the most important aspects that we're looking for, and that is authentic and effective partnerships. So it's not enough to be tokenistic. You have to feel as a surveyor when you go into an organisation that that spirit of partnership and collaboration is actually throughout the organisation, and it's not just a couple of exercises that an organisation has done to get ready for accreditation. And that effective is actually a very interesting part, I think, of that line because it's very hard to prove effective partnerships, and we'll talk a little bit more about that as we go along. We're also looking for a multi-pronged approach, and what I mean by that again is that, and some of you will be familiar with just seeing the same faces at the table representing consumers on every single committee for every single thing, and it's just the one way that we're actually partnering with consumers, just that through kind of committees. So it's kind of what I'd like to call the middle layer of consumer engagement. And there's a lot of tools and techniques that we can use to actually partner effectively. And organisations that are just doing stock standard, just one consumer at a table once every 2 months, you know, you as a surveyor, you really start to feel a little concerned if that's what you're seeing. Partnership at all levels, and this sort of follows up from the last point too. So it's not enough to have just excellent bedside care and excellent partnership at that level, but have nothing in the middle or at the kind of governance level of an organisation. And reversely, it's not enough to have lots of things happening at the governance level, but really be ignoring or not effectively dealing with that bedside level. And again, I think we've been to organisations where there's a lot of talk, a lot of rhetoric, and that happens at the executive level, but you just don't see that sometimes when you're in the wards or in outpatients or in the community health setting, wherever you're actually looking. It should be systematic and coordinated, and what I mean by that is, I think again, as a surveyor, but also as a healthcare professional and as a consumer, you know you've been in hospitals and community centre that you go in and one team are fantastic, one team partner with you brilliantly, the next team or the next ward or the next doctor and his team, there's no partnership. And it's fascinating in organisations where there's actually little pockets of excellence, but overall you really don't see that it's systemic, and certainly it's not coordinated, and there's not a collaboration between teams. And this is a little bit along the same lines, but really what you want to see as a surveyor is that there's a consistency of attitude and support. So you don't hear something different from the executive than you hear from staff, that you don't hear something different from the consumers on how effective those partnerships are than you hear from staff. And you do hear that sometimes when you go into organisations where staff are, again, sprouting partnership, but the consumers say, oh, well, you know, it's not too bad. I mean, you know, we don't get a lot done, and, you know, a lot of our, you know, feedback doesn't really get listened to, but yet there's this amazing kind of rhetoric in place. Not just relying on the same suspects, and what I mean by that is sometimes when you go to survey an organisation, you actually begin to feel sorry for those one or two consumer advisors that are on every single meeting, and there's no other involvement, it seems, from other consumers, and I think that's always a little bit of a worry. And this is where a lot of organisations are struggling, but the standard really does demand that we prove that the partnership is somehow making a difference, because it's very easy to, I think, involve consumers in a slightly tokenistic fashion if you wanted to, or even not if you wanted to, just because it's easy to kind of overlook that feedback. So just collecting the feedback sometimes people feel is what the partnership's about, but in fact it's actually responding to that feedback and actually partnering with consumers in the responding to that feedback that really is evidence of where that partnership is really making a difference. And I'll talk about that a little bit more as we go along. I think we also really want to see that it's not just all done yesterday. And again, I've actually surveyed an organisation where they literally, the colour printer broke down 5 minutes before the surveyors arrived, and so some of the posters went up on the walls. Now, there was pretty much nothing on the Friday. On the Monday morning, you know, the walls were full of partnership. Well, that's not really what we're looking for. And this is going to be less of an issue as we go forward. There's going to be, I hope, very few developmental actions, and hopefully everyone understands what I mean by that. So within the standards, there's core actions that have to be met, mandatory actions, and there's only 4 of those in standard 2. And the rest of the standard is developmental. And some organisations you go into have focused really heavily on those 4, which makes sense, which is about information for consumers, publications, quality and safety, information access, and consumers involved in planning, I think, are the 4. and they've pretty much done absolutely nothing with the rest of the actions in the standard. And I think surveyors are always a little suspicious of that, because all of those actions within Standard 2 really add up to a whole. And if there is a philosophy of partnership across the organisation, then there will be some activity across all those actions, not just in the ones that they're being, they're being judged on. So in a little bit more detail, I've just gone through really, really quickly an overview of what, what we're looking for. So in detail with the actual standards, what we're looking for, sorry, I'll just go back. I got ahead of myself. Okay. So with 2.1, and we don't have I will tend to, because a lot of the information that I'll be sharing starts to get a little repetitive, we'll go into a lot of detail for the first couple of actions in the standard, and then we'll kind of get quicker as we go along. So for 2.1, which is establishing governance structures to facilitate partnership with consumers, what we really want to see as surveyors is that there's an entrenched partnership with consumers, that it actually exists in the governance structures. And what we mean by that is that the committee structure needs to actually reflect where consumers are involved on key committees, that the strategic plan needs to actually show us where consumers have been involved in the development and actually the implementation and the evaluation of that plan, that key governance committees, that there are consumers involved, and that their feedback is actually being utilised. So 2.1 is really one of those fundamental actions within the standards that really should go across all of the standards, or 10 of the standards. So, for example, I've been into an organisation which had a wonderful committee structure which showed us exactly where consumers were involved, what their background and expertise was, what their linkages with the community and other consumer advisors or patient groups were, and how their feedback was being utilised. It was a really impressive document, actually. And it's not that hard to do if you're actually partnering with consumers effectively. And interestingly, that committee structure document and their improvement plan were actually heavily co-authored with consumers, and you could tell. And so if there's only one thing that you hear in this whole talk, and that is that it's the most effective partnership with consumers, obviously, is when it's actually designed, developed, implemented, and evaluated together. So if that's all you listen to, if that's all you hear in the talk, that's I've done my job. So, for example, in an organisation which services a lot of rural consumers, you would want to see how they're actually engaging rural consumers in those governance structures, even though that's challenging. So are they utilising technology? So that traditional method of having a consumer rep or two on a committee obviously is not going to be the model that's going to work for some healthcare organisations. The governance framework, I've just said that, needs to be really clear on where the facilitation's happening, but also who is actually involved in that governance framework, and where those committees are reporting to, who is supporting consumers to actually be effective, and who is supporting health staff to be effective in that partnership. We also really want to see, and again this is a key point for the talk, is that a variety of consumers from different backgrounds need to be involved in governance processes, and that should really reflect the population being served by the organisation. And this is something that organisations struggle with terribly, and I know that 2/3 of people online are health service staff. And because I have actually been in, a large hospital, and I've been trying to get consumers from different backgrounds and to kind of really reflect the diversity of the organisation I was a part of, I know how hard this is. But it can't happen if you just use traditional methods of partnership. So there's a lot of groups of patients and families and carers that really can't attend a meeting and they want to be involved in many, many other ways. And I'll actually talk a little bit more as we go along about some of the good ideas that I've seen of how people have done that and how I've done that myself as well. So with 2.2, with implementing policies and procedures for partnering with consumers in planning, safety and quality. Surveyors are really looking for a very clear, articulated plan, policy framework, and to me the pretty pictures are less important than the actual content of, again, who's actually involved and what level of engagement there is, and where that reports and how effective is that information being used by the organisation. We want to see, again, evidence of consumer involvement across all aspects of planning, service development, improvement processes. And what I mean by that is a lot of organisations are actually running surveys, which is great, focus groups, which is great, interviews, a whole range of methods, different methods. But then what they're doing is actually using that information just in working groups that only have staff on them. So the interpretation of the feedback from consumers doesn't involve consumers. And if I was a surveyor looking at an organisation that didn't have consumers throughout the whole sort of process of improvement, then I would think that they were not actually meeting the standard. And we'll talk a little bit more about that as we go along as well, because again, that's in most of the actions in Standard 2. And evidence. And it will be interesting if we get some time at the end, if anyone's got some great ideas about evaluation of partnership. It's a very difficult area, and we do as surveyors understand that. Many surveyors are actually, healthcare professionals working in the system, and actually have been, had played a role in their own accreditation for their own organisation. So we know how difficult it is. But we can't stop trying to really make sure that the evidence is there that our partnership is working and can't be improved. So 2.3, facilitating access to relevant orientation and training for consumers partnering with the organisation. And I know Health Consumers New South Wales is doing some major work on this, which is fantastic. So for health service staff members out there, it would be actually, I would really commend you to actually have a look at the training and the framework that Health Consumers New South Wales has developed. It's excellent. And there's just no point everyone doing their own training when there's some very good training that exists. Sometimes some organisations do an orientation for consumers, for consumers advisors, but then consumers are kind of left on their own after that. And as a surveyor, we would not think that that's really meeting 2.3. If you're not really got ongoing development for your consumer advisors as you would for staff, then really you're not, that partnership, you're not really being terribly authentic about that partnership. It's important to have a level of formal orientation and ongoing development for consumers, but also informal support, I think, is critical for consumers. And that's just a follow-up phone call, a coffee and a chat. How's it going? What else could we be doing? How else could we support you to be more effective in that partnership? And I think that that goes for staff as well as consumers, because partnership takes two. And so we really need to be making sure that both sides of that partnership are getting the education, the orientation, the training, but also the support to be effective. Also, it's really important to see varied opportunities. So again, just the, you must come on a Monday between 10 and 12, because that's, once a month. That's when the orientation is for consumer advisors. It really doesn't work for a lot of different groups. I've worked with young people for many, many years, with children and young people and families. Now it's not an approach that works with young people at all. So there's a lot of current technology that you can utilise to actually get to those groups that are hard to get to and provide that orientation and training in a slightly more innovative way. And I think that this is the bit that is really overlooked, I think, by a lot of healthcare organisations, and that recognition and reward is really important for consumers too. And the consumers that are actually online, it would be really interesting to hear from you if any of you want to pop a little comment in to the chat boxes. But you know, we recognise, most organisations recognise that this is important for staff, but we often forget that consumers are putting enormous amounts of time, effort, energy into the organisation, and really there's very little recognition and reward sometimes. So to really be meeting standard 2 and really be living the spirit of partnership, that's an important aspect. So for 2.4, consulting consumers on patient information, it's interesting because this action is mandatory and it's actually being done pretty well by most organisations. The bit that's being done well is that everyone's got a policy. They seem to have processes to enable consultation with consumers. Now, note that I didn't say effective consultation because that is one area that actually is perhaps not being, really demonstrated very well by a lot of organisations. So. Also, the principles of health literacy, some organisations are doing a very good job of that, but many, many more aren't. So whilst the patient information looks pretty and they do change some things in response to consumers' feedback, those fundamental principles of health literacy are not really being implemented. In the new revision of Standard 2, I believe there's going to be a very strong health literacy component, which I'm really pleased about because, again, that's actually enabling that partnership to happen if those principles of health literacy are being utilised. A range of consumers being given the opportunity to be involved, and it's amazing how often you go into an organisation and they've got a small group of consumers who are providing them feedback on patient information. But in fact, it's not that none of them have lived that patient journey. So they're commenting on, and still their feedback's valuable, but if an organisation is not involving the consumers who are actually going to be utilising that information, then I don't think they're meeting that action within Standard 2. I also did have an organisation that I surveyed a while ago now who had a very, very large culturally and linguistically diverse background population, and all of the consumers who were actually involved, there's 3 consumers who were involved in their reviewing their publications. None had a CALD background, and none really had actually, say it was maternity, none had actually had a baby, and they were, well past that. So that's really interesting. So we want to see the people who are actually using the service being the ones who are commenting. And as a surveyor, you really want to see, and as a consumer, I think you really, really want to see that there's evidence that that feedback's actually being used in the final documents. And I've actually seen a great organisation that tracks everything. So every bit of feedback that they're given, they track and they say, we've actually added this to this policy. We haven't added this to a policy because of this. So, and I know those consumers feel heavily invested then that their actually feedback has been listened to and that the final product is that much better because of it. Also, I think something that gets missed a little bit by a lot of organisations is that the publication should really reflect the population being served, and I don't mean just the information, the content, but the look of the document as well. So if you're serving a large paediatric population or young people, and it's a staid, looks like something like Westpac Bank would put out, then that's not really for them, that's for someone else. If you have, again, a very large, group of people who speak, Chinese, and there's no element of that culture in the final publication, then again, you're not doing your job. So you're not meeting the standard. And it's amazing, years ago I had a discussion with a graphic designer who were designing some information for a children's hospital I was working for, and The whole patient information booklet had extremely young, attractive, blonde staff and extremely cute, blonde, blue-eyed, no-haired, little tiny children. And I said to the designer, do you see, this looks like something from Scandinavia. This does not look like the hospital I worked at had 40% of people were not born in Australia. And it came from a range of cultures and backgrounds, and that included staff as well. So anyone using that organisation that looked at that publication, it doesn't reflect them, doesn't reflect really the population being served by the organisation. So that's something that is really important and gets missed a lot. With 2.5, partnering with consumers to design the way care is delivered, it's really interesting that in fact consumer voice, it's got to be evident in all stages of design, redesign and the improvement. And I know I've said this before, but I think it's really important to actually emphasise that you can't just do a survey. What we mean by really meeting that action 2.5 is that you have to have consumers involved in the design of the improvement activity, then in the collection of the information, so the design of the survey, for example, and then actually in the evaluation of what does that information really mean and what are some solutions for redesigning the system so it better meets the needs of patients and families. And then those consumers also need to be involved in, were we successful? Was the improvement process what we needed, or do we need to go back to, back to the drawing board and actually have a look at, other solutions? But so often you go into an organisation and they're actually doing improvement activity and redesign activity, but in fact the consumers are only involved in one little tiny bit in the middle. So they're not co-designing with staff, which is actually what we want to see. We want to see co-design. We want to see partnership from the beginning to the end, and that's where the most effective outcomes will be achieved. Again, the techniques and tools should reflect the population, and again, using the example of young people, there's so many technologies now that you can use for young people, and that's the way they live, Twitter and, Instagram and Facebook and a whole host of things I don't really even understand. But what I've always done is actually got a group of young people together to help me, because I'm not that techno-savvy, and I don't need to be, because my consumers are there to actually help me with designing how they should be partnered with. And we've had some fantastic, I've been a part of some really fantastic improvement activity involving children and young people. And I think sometimes we really don't, we don't expect enough of children and young people, and there's some other groups that I think the same can be said for. So in terms of implementing training for staff on consumer engagement, I actually think that, again, I know I'm sounding a little repetitive again, but consumers need to be involved in helping design this training. So not just a consumer comes and delivers the training that a staff member has designed once a month at orientation and they talk for 20 minutes. Okay, that is not what we're talking about in terms of training for staff. What we're talking about is really consumers and staff together designing what's going to be the most effective information to share with staff so that they can actually create and develop and sustain really effective partnerships with consumers. I think the training also needs to be ongoing and integrated, and it's interesting, some organisations, not a lot actually, there's an element of partnership with consumers training in every single training that they're running. And that's how it should be, rather than this one single little training program which is on consumer engagement. It's a part and parcel of every single thing that they do and say, and that's when you know an organisation really has systemic and effective partnership with consumers at, from the board to the bed side. And again, one size doesn't fit all, so lots of patient stories and video and webinars are brilliant. Actually really using the technology that's available now is really important. And evaluation of the effectiveness of the training is also critical to provide surveyors, but also to provide consumers, so that we all know that actually that training's being effective. And I don't just mean the standard evaluation which we normally do, which is, you know, the venue was good, the presenter was good, the food was good, the information was fine. I actually think to really meet this standard with merit, you really need to be actually following up with staff to say, did this change what you thought? Did this change what you did? You know, in the last 6 months since you had the training on partnering with consumers, how have you partnered with consumers? How has this changed what you do? And has it led you to being more effective? If not, what else could we be doing and should we be doing? So I think that, again, very few organisations are doing that kind of longitudinal evaluation of the effectiveness of training, but I think that that is critical. So I've put all these together because they're very, very similar, and again, we've actually talked about what surveyors are looking for, but really what is in the spirit of the the standard. So I'll just run through this very, very quickly, and that is really involving consumers in measurement and evaluation. And I was surveyed in an organisation not that long ago, and they were providing really good information about quality and safety to their consumer group, their peak consumer group. And I understood the information because I've actually been in charge of a clinical governance unit. But it was pretty dense kind of data, I have to say. And I said to the consumers, you know, how do you find this data, and you know, what sort of feedback do you give, and you know, how is that utilised? And they kind of looked at me a bit sheepishly and said, well, we don't really understand it really. But it's okay, because when we mentioned that to staff, they said they don't really understand it either. And I had to stop myself from laughing actually, but I thought that's really ironic, isn't it? And they did then have one consumer who really helped them say, look, there's no point us getting this information unless it's in a format that we can really understand and utilise, and give you some ideas for, you know, for how to move forward and improve as a result of it. And in fact, the staff then said to me, I followed up with the organisation after a few months, and the staff member said to me, it's great, you know, because now everyone understands the information. And before, really, it was just really the quality manager and, you know, some of the executive who really understood what that meant. We also really want to see the right information for consumers, and I think sometimes we say, okay, the standard says we've got to give consumers information about quality and safety, so we just give consumers all this information which isn't really relevant for them. So again, the only way to really know what it is that is relevant is to ask, and then to act on in partnership with consumers. And I know I'm getting very repetitive now, but again, the processes that are put in place need to actually really link with other key actions and activities. So what I mean by that is you don't just want your partnership with consumers program to be in divine isolation. It's fundamental to every single thing that the organisation does, and they need to demonstrate that when they're being accredited. We also need to ensure that that support's required, particularly for that domain of quality and safety, because that's a hard one to really understand at times. We've talked again and again about designing and developing it in partnership with consumers. So we actually, with the best practice in action, I think we've only got about 8 minutes or so. So I might just come back to that in a second. And I'll just summarise very quickly what we're looking for, and then I'll just give a couple of examples as we go through these of things I've seen. So we're really looking for an overarching philosophy and commitment to partnership that every staff member understands. And again, the good organisations I've seen do this have actually developed that documentation, posters, you know, videos, patient stories, staff stories. They've actually developed those in partnership between staff and consumers, and the outcome's been very good. We're also looking for effective systems and processes to create and sustain respectful and effective partnerships. And sometimes you see a lot of great activity, but it's really very ad hoc. There's no real rhyme or reason to it, and there's really no system in place. So you just know that once those 1 or 2 really motivated staff and consumers leave the organisation, then the whole program is going to fall over, because it's really not part of the system. We want to look at evidence of partnerships at all levels, and I really use this term bedside to boardroom a lot, because that's what we're talking about. It needs to happen at the bedside, in the middle, and at the boardroom as well. So those really governance levels, and you're not meeting the standard unless, or the spirit of partnership, unless you can see partnership at every single level in an organisation. The partnership program has to reflect what that population who's being served has, and it's actually interesting that again, some organisations, they say, oh, well, we just can't get someone, so we have 30% of people who are Arabic speaking, for example, but we just can't get someone who's Arabic speaking on our, on our peak consumer group. Well, think of other ways to do it. And I know an organisation I've worked with in the past had a couple of groups that actually, so we had Arabic-speaking mothers group, for example, and they met regularly, but they didn't want to do a lot of hospital engagement, but they were happy to actually, they were actually happy to be asked and be engaged in some key issues. So once in a while, we would ask to go to that group, and we got some fantastic information. Now, we didn't need those mums to sit on the group, because they didn't want to do that, but they were very happy to be engaged with in a number of other ways. There's a lot of support groups and that are happening out there that health organisations can access, but they don't seem to be doing that. And again, technology, I think, is really helping us to actually come up with some innovative ways for people to provide feedback and be part of improving the health system that they use without actually having to come and sit on a meeting. The clear evidence of partnership, and again, I've seen a couple of organisations of late. Actually, when I started surveying years ago, you really did see it at all. Now I've seen a few organisations that really have excellent ways of presenting the information that this is actually what we've done. So we've actually had consumers involved in this particular project, and this is what has been the outcome of that partnership. And it's fantastic, because it continues to then reinforce to everyone across the health system how important it is and how effective it is to partner with consumers. Reward and recognition for all team members, we've discussed that, and really a commitment to implementing both the spirit and actions of Standard 2. And it's interesting, because I use this term will and skill a lot. So I actually think in a lot of health organisations you see enormous, and with consumers you see an enormous amount of will to partner effectively. But you often don't see the skill to match that will. And that's really what we want to see organisations doing, is not just supporting the will, or the philosophy, but actually building the skill for staff members and for consumers. And actually having those two access a lot of the same education. And again, an organisation I've surveyed had a fantastic program where the consumer advisors could do any of the training that was offered to staff. They regularly got a calendar, would you like to do this, would you like to do that? There was some specific education for them that they could access, but also they could access anything at the hospital, which I think was a really good process. And also the same organisation regularly sent a couple of consumers to appropriate conferences with staff as well. Again, it's actually really reinforcing that spirit of partnership and the effectiveness of it. It's not hard to involve consumers in reward and recognition for your staff, and for staff to be involved in reward and recognition for consumers. So it's really not hard to do those two things at the same time as well. Now, just how long have we got? Let me see. Oh, we're coming to the end, aren't we?
We are getting close, yeah.
Yeah, yeah. So, well, maybe should we just start having a look at some of the questions? I've given you a few ideas of things I've seen organisations do. If we don't have a lot of questions, then I'm happy to talk of a few more. But should we start with the...
Yeah, Lizzie, I've got some questions that people have been asking as you've been presenting. And the first one was, how do we really know that consumers understand what is being said to them? Check boxes and sign forms do not really demonstrate that they understand. Any ideas?
Yeah, absolutely. So, and this one actually is an interesting one that I struggle with dealing with children a lot. So, it is, you know, how do we really know that kids have been engaged to an extent that they can? Because often in a health system, kids get, you know, it's a children's hospital, but the kids get ignored. Everything gets directed to parents.
Mm-hmm.
And in fact, you can actually run a focus group very effectively with kids as young as, I've done a focus group with children that were 4 and 5. Now, you have to have some skills, so you need someone who's skilled at facilitating that. It's the same with, you know, again, a group of, you know, elderly people, or a group of veterans, or, you know, a group of rural people who, so long as you actually have someone who really does, is part of that group, or really does understand the needs of that group, and they can help you facilitate that process. But focus groups, surveys are kind of some of the more effective ways to know that people have understood. I think there's Teach Back. I don't know if people have heard of Teach Back. It was designed in the States, but it's where the information is given in a written format. It's also given in a verbal format, and then the staff member has a really simple checklist for making sure that the that the patient and their family or carer actually understand that information. And it's a really nifty little technique, actually. I don't know why we're not using it more. I think with the work that they're doing on health literacy, CEC and the Australian Commission are doing on health literacy, I think that Teach Back technique is actually going to be, you know, we're going to see a lot more utilisation of that technique. Does that answer the question?
Yeah. I think it does partly. I think it's a question that probably relates to both consumers as representatives and who are partners, as well as consumers who are actually consumers within the service. But it also leads into another question, which was, do any organisations or health services run courses in health literacy for the consumers they want to engage? Have you come across that?
I haven't come across organisations that are just running courses just on health literacy, but I have a couple of really good organisations that have those principles of health literacy as part of their other training programs for consumers. So for the orientation program, for example, there's a whole section on the nomenclature, that's the terminology that's used. So say a consumer advisor is going to be on their quality and safety committee. They've actually got a whole resource about the sort of information that's presented, what it means, and there's someone that person can meet with before and after meetings as well, so that they can just run through anything that they're not comfortable with or not familiar with. It's awful being in a meeting with consumer advisors, and this goes for staff as well, where you can just sense that half the room does not understand the information that's being presented, and there's no ability to actually really provide feedback because no one understands what's going on. I think that with the answer to the last question and this question, it's critical to ask, and there's lots and lots of ways to ask, formal ways and informal ways to ask, do you understand? Yeah.
I'm going to move on to, I've got a couple of comments and a question that are related, and one of the comments was that a Sydney major hospital had no parking or travel costs paid, and then another question was, so I'll take that as a comment, and another question was, when we asked consumers at a metro hospital in Brisbane how they'd like to be recognised for their work, their response was uniform. It was pay us, e.g. reimburse their costs and pay them for their time and expertise. So that I guess that's another interesting, I guess, example of how consumers felt they would like to be rewarded. Is that? Do you have anything to comment on that, Lizzy?
Yeah, look, I do think that consumers would absolutely be having their out-of-pocket expenses met, absolutely, and also be receiving some sort of, stipend or something like that. The problem is that oftentimes that can limit people's consumer programs to a couple of people, and that always seems to me a real shame. When I've been involved with a lot of consumer groups in my time, and it's interesting, whenever that question has come up, it's surprised me that most of the consumers I've dealt with don't want to be paid. It's interesting. They don't want to incur any expense, and they want to be rewarded and recognised for their work and their effort and their contribution, but they don't want to be paid as such, because they feel that by receiving payment from the organisation, they lose their independence and they lose their they're a little bit more, beholden to the organisation, which is it's a really interesting perspective, actually. But one organisation I worked with, we fundraised to send 2 of our consumers with a staff member to a conference down in Melbourne, for example. So, and we left it up to the consumer group to decide who the 2 should be. We only could afford 2, but we ran cake stalls and to raise that money. So there's lots of ways to do that, but also that was a huge recognition of that group's work to say, now we're going to, we actually want to thank you, and also it's vital for us to have you there with us because you're doing the work with us, so you need to be doing the training and getting the reward as well, which, a conference is a bit of a reward, and a bit of travel. So, but it's not easy, but I think there's lots of small ways every day to actually thank consumers, to give them. I used to run a group and I would give them at the beginning of the year, I'd ask them what their printer cartridges, what printer cartridges they used, and give them, some ink and some paper, a ream of paper each, just as it's a token, but it's actually we know you print a whole stack of stuff out to read at home, and if there's anything really big, we're going to print it and we're going to send it to you, post it to you, so that you don't have to use your own resources to help us. It's just little things like that, and making sure you always have a nice lunch and but in New South Wales, I know the policy is very clear that consumers must have their out-of-pocket expenses met. So, so that organisation, whoever they were very naughty.
They're really good examples there, Lizzy, and I guess those 2 examples of where one set of consumers in Brisbane said they'd like to be paid, and you know of, and I've heard of consumers who don't want to be paid, just goes to show that you can't assume, and it's worth asking. But I guess that also goes to asking in a sensitive way that allows the consumer to honestly tell you what they think is important. That's right. That leads on to one of the great questions that just came through at the end, which was, could surveyors also look for a budget? Often one of the key barriers raised by staff is the lack of resources for them and the consumers to engage effectively. So is that something you've ever looked for?
Yeah, and look, not a budget as such, but we mostly all do look for that there is at least a position, not that's dealing with consumer engagement all the time, full time, because some small organisations obviously can't afford that. But if an organisation doesn't have someone whose role it is to run consumer engagement program, to support the consumers, to recruit consumers, to facilitate the processes throughout the organisation, you really do have to wonder even if there's a lot of rhetoric about supporting partnering with consumers, you know they're not really putting their money where their mouth is, which is a problem. I think we're seeing less of that. I think many more organisations are recognising the benefit, and I think that that's something that people can really consider as well. Health service staff out there, I've had to in the past really grow my resources for consumer engagement, from having nothing, having to do it all myself in my own time, to actually having a full-time consumer engagement consultant on board. And that was over many years, but how I did it was just constantly saying, okay, if you want this as an organisation, you have to provide some resources and support, but this is what you're going to get. You're actually going to get all the activity that you're doing, for example, the improvement activity you're doing, is going to be that much more effective. You are going to save money by putting some money into consumer engagement.
Yeah. Oh, wow, that's a fabulous example and a lot of hard work, I know. But I'm sure there's others who are nodding their heads and saying, yes, that's what it's like for me too. You raised the question of evaluating partnerships, and yeah, it's not an easy thing, which you indicated. How do we go about doing that? And I wondered if, at the very least, to plan how an evaluation plan for consumer partnerships surely would involve consumers. That would be an important part of sitting down together to say, how do we evaluate our partnership in a year or 2 years' time?
Yeah, absolutely. And I also think that if it's not part of, if surveyors are looking at say improvement projects, which is standard to look at the people's kind of improvement projects, and they don't see any evidence that consumers have been involved, I think that that's something they have to be concerned about. But also, if they haven't built in from the very beginning how the activity is going to be evaluated and who's going to be involved in that. And I think, again, there's enormous will there with organisations. I think they run out of steam. I think they're so busy doing, the redesign and the improvement that they don't actually stop to think, oh, are we actually doing the right thing? Are we doing what's needed and wanted by our consumers? And the only way to know that is to have the consumers involved, I think many more organisations are getting better at that, and I think there's a lot of resources out there too. In New South Wales, ACI and CEC are very good, and I'm sure in every state they have, government and NGOs that are very good at this. So, and like I said, with Health Consumers New South Wales have got a great resource in terms of training for consumers, but also for health staff. So access those things.
Yeah, that's true. I'm just going to pop up in the comments section the link to our new consumer and community engagement model, if anyone is interested in looking, if you haven't already seen it. And we are encouraging organisations to look at this model as in terms of designing an evaluation plan with their consumers. You can use the model in a whole lot of ways, but that is one thing we'd really like to encourage. And then if several organisations are using the same model, then we can actually start to do some comparisons and talk the same language. But I'd like to close off the questions now and thank Lizzy very much for her presentation. Everyone who's still there and still listening, Lizzy's slides will be available after the webinar and they'll be emailed out to you all. There will also be a recording of the webinar that will be available shortly. We'll put it up on the website and we'll also email that link out to you all. So apologies if we didn't quite cover your questions, but I think we actually did pretty well. And I think we'll wrap up now. So when we do finish, all of the participants will receive a quick evaluation of the webinar. If you've got a question that you haven't asked, you can. There is a part of the webinar that asks for suggestions about future webinar topics, and you could actually pop that question in or just also give us suggestions for future webinars. We're quite interested in receiving those from you. So thanks very much, Lizzy. Thank you, everyone, for participating and attending today. And I'll look forward to catching up with many of you next year at events and also future webinars. Thank you very much, and goodbye.
Thanks, Karina.
Are we done?